healthcare provider has recommended that you take Follistim for help with your fertility treatment. This medication is delivered with a pen. It's fairly easy to do. You just have to follow a few easy steps. The first step is to open the box, and inside you will find small needles and a vial that actually has the medication in it. To administer this medication, you'll also receive a Follistim pen. Begin by opening the box, opening the pen just by removing the top, straight by pulling it, and then unscrew the blue part from the yellow part. After that's open, take the cartridge, and just like cartridge pens you may have used previously, you put the color tip of the cartridge straight down into the yellow part. Then you put the blue part back in and you screw it together. You know you put it together right when you look to the left of the window and you see these two arrows line up. Next, you want to dial your dosage. For today's demonstration, we'll say your dosage is 100 units. You just click and dial the dosage until you see 100 in the dosage window. Next, put the needle on the tip of the pen by removing the foil cap first, just peeling it off, and then it screws directly onto the tip of the pen. The first cap is just for recapping. The second cap is to protect the tiny little needle. Then it's ready to administer. Generally, you'll see a tiny little drop come out at the tip of the needle as soon as you assemble the product. Next, you will choose the area that you want to administer the medication. If this medication is generally given subcutaneously beneath the belly button and out to the side a little bit, or in the outer thigh. I think it's easiest to give it beneath your belly button, just to avoid any bruising. Then you can wipe the area that you choose with an alcohol prep, bunch up the tissue, take the pen with the needle pointing toward the skin, insert it directly in, grasp the plunger, and push it in. You'll feel it click and hear it click ever so slightly as you push it in. Release the plunger, release the skin, wait about 3 or 4 seconds, then pull the needle straight out all the way. If you notice a little bit of fluid or some blood at the injection site, no worries, just wipe it with alcohol and apply a bandage if needed. After you've given the medication, use the cap, the bigger cap, to remove the needle just by unscrewing it, and then place it into a sharps container for proper disposal later. After you've administered the medication, look back in the dosage window and make sure it goes to 0. If not, you've not given all of your medication. Simply put another check to make sure that there's still fluid in the pen, in the cartridge. If there is, reapply another needle and you're ready to inject again. After the injection, you can simply recap the pen and place it on the counter. It can stay at room temperature until it's time for your next injection. Then follow the same steps. Take a look at the packaging when you receive the medication and see what your dosage is. Keep in mind that there may be some fluid still left in the cartridge after you've given what this dosage adds up to. That's because all of these pens are overfilled some, and you don't want to waste that medicine. So if there's still medication in here, you can use it. If you're close to the end of using the pen and you withdraw all of the contents, when you take the needle out, it'll still have what dose you need remaining for the next cartridge. If you have any questions, you can always ask your healthcare provider, but now you've completed your Follistim injection.